Hello, Pharma aspirants. Welcome to Pharma Syndrome YouTube channel. In this video, I am discussing about drugs for cough. So, as you know already, cough is a irritative stimulation on your bronchial smooth muscle. When our lungs irritated, our bronchial smooth muscles get irritated. It gives signal to the central nervous system. From the central nervous system, the reflex action will come like to decrease the irritation, to reduce the cough reflexes, And here, some drugs here I already mentioned, the drugs used in the treatment of cough. So there are four categories of drugs are there. In that, first one is the expectorant. So what is expectorant here? Medicine that promotes secretion of sputum by the air passages that used to treat cough. So sputum is nothing but a viscous secretion which disturbs our throat during speaking, maybe during sleeping also. So that excess sputum will eliminate by using the expectorants, and examples are here by using mnemonic GAPS, GAPS. The mnemonic is GAPS, and here G means gabapentine, A means ammonium chloride, P means potassium iodide, S means sodium citrate. So all these four drugs are known as a expectorants. And next category is the pharyngeal demulcent. So these are the demulcents are nothing but agents. These are for the smoothing purpose, soothing purpose. And these are generally used to lubricate and protect the alimentary mucous membrane. So the mucous membrane, it will smoothing the, nothing but it will decrease the roughness, especially decrease the roughness, and make the sputum lubricant and eliminate from the throat. And examples like lozenges, lynxes, liquorice, all this comes under the pharyngeal demulcents. And next is mucolytics. So mucolytics, the name itself indicating they break down the mucus. So mucus is nothing but thick secretion which disturbs again our sleep as well as our way of speaking. So here mucolytic helps in the clearance of mucus or sputum from the upper as well as lower airways. Mucolytics includes expectorants, mucokinetics. Nothing but mucokinetics means increase the movement of mucus outside of the body, outside of the throat. And these are also called as regulators of the mucus. So they down-regulate the excess mucus secretion also. And examples of these mucolytics with the mnemonics CAPS. So C means carbocystine, A means acetylcysteine, P means potassium iodide, S means sodium citrate. All these are comes under the mucolytics. They break down the excess thickened mucus and helps in the clearance of throat. And final category is the antitussives. The name itself indicating they use it to control cough, especially dry cough. And the common example is codeine in the form of codeine phosphate. So what antitussive is doing? It is a cough suppressant, relieve your cough by blocking the cough reflexes. So from the CNS itself, they decrease the reflex of cough. And here the mnemonic is pandemic. P means falcodine. Again, P means prenoxidazine. A means antihistamine compounds. N means noscapine, one of the derivative in the opium alkaloid. And DE means dextromethorphan. And codeine is nothing but in the form of codeine phosphate, useful for the treatment of cough, especially dry cough. So this is simply regarding the cough, what is cough, and what are the different categories of drugs used in the treatment of cough. So like this more interesting and crazy information, follow Pharma Syndrome YouTube channel and subscribe to our channel. Thank you.